5,000 rupees. That's what Rajesh from Mumbai spent on his comprehensive health checkup plan last month. His cholesterol came back high. His doctor immediately started him on statins. But here's what nobody told Rajesh and what might really shock you. His results were misleading. Not because the lab made a mistake, but because of something he did the night before his test that made his cholesterol appear 20% higher than it actually was. I am Dr. Sumit Kapade, a vascular surgeon, and in 18 years of practice as a vascular surgeon, I have seen many patients get distorted blood test results because they did not know what mistakes they had made. And these mistakes were completely preventable. In the next 6 minutes, I'm going to show you the 10 most common mistakes that can make your expensive blood tests completely useless and exactly how to avoid every single one of them. Let me start with something that happens in Indian households every single day. You wake up at 6 a.m., skip breakfast, rush to the diagnostic center, wait in line, get your blood test done, pay 2,000 to 5,000 and wait anxiously for the result. And then panic. High cholesterol, high triglycerides, elevated liver enzymes. But what if I told you that your high cholesterol might actually be normal, that your elevated triglycerides could be perfectly fine, that the medication that you are about to start might be completely unnecessary? The truth is, most people, including many doctors, don't realize how dramatically your actions in the previous 24 hours before a blood test can distort your results. So let me tell you about the most expensive mistake I see in my OPD. Picture this: Saturday night, your cousin's wedding, amazing food, you eat till 11 p.m, butter chicken, naan, gulab jamun. Sunday morning 8 a.m. blood test. Monday evening your results arrive. Triglycerides 400 mg per deciliter. Normal is under 150. Your doctor says you need immediate medication. But here's the medical reality. That heavy meal 9 hours before your test can spike your triglycerides by almost 200%. Your dangerous reading might actually be somewhat near normal. This is mistake number 1. Eating a heavy meal within 12 hours of your test, and it's just the beginning. Mistake number 2 is something that 70% of my patients do wrong: dehydration. Doctor Saab, मैं 12 घंटे से कुछ नहीं खाया. I haven't eaten for 12 hours. But when I ask about water, they say, पानी भी नहीं पिया. Fasting में सब कुछ बंद किया. This sometimes can be dangerous. Because when you are dehydrated, your blood becomes concentrated. Your hemoglobin may appear to be higher. Your kidney functions sometimes get distorted. Your blood pressure medications seem to be less effective. So the correct approach is you should have fasting from food for 8 to 12 hours, but water only up to 4 to 6 hours. I have sometimes seen that even marginally raised creatinine, which is a kidney test, happens because the patient stopped drinking water for 12 or 14 hours. So remember, slight elevation of creatinine also may happen if you are dehydrated. Now here's mistake number 3 that also surprises many people. You have 6 a.m. on the test day, you wake up, skip breakfast like you're supposed to, but then habit kicks in. You take your morning vitamins, multivitamin है, vitamin D है, B complex है. डॉक्टर मैंने तो खाना नहीं खाया, सिर्फ vitamins लिए. But the biotin in your multivitamin can falsely elevate your thyroid test. Vitamin C can also affect your glucose readings. Iron supplements can sometimes distort your liver function test. So the rule is no supplements or vitamins on the test day morning. Take them after your blood sample is over. Mistake number 4 will shock the fitness enthusiasts. Monday morning, 5 a.m., go to the gym, heavy deadlift, intense cardio, 8 a.m. you're ready for the blood test. You think you're being healthy, right? Wrong. Intense exercise within 24 hours of your blood test can also cause increase in your muscle enzymes by 300%. It can spike up your white blood cell count. It can increase your CRP or inflammation markers. It can slightly distort your liver function test. So if your doctor sees elevated muscle enzymes and thinks it's a heart attack, or sees high WBC cells and suspects infection, Sometimes it leads to more tests, more anxiety, more money obviously. But what is the solution? No intense exercise 24 hours before your test. Normal walking is fine, but intense exercise, try and avoid it. Now, mistake number 5 is the one that most of our people do not talk about honestly. It's about alcohol. Friday night hai, office party hai, just 2 drinks, Saturday morning ko blood test. But remember, alcohol can affect your liver function test for 72 hours. Not 12 hours, not 24 hours, but 72 hours. Your alkaline phosphatase, your GGT, they all may come elevated. Your doctor might think that you have liver disease. He might refer you to a gastroenterologist, get an ultrasound done. But the truth, your liver was fine. It's just processing the alcohol you had 2 days ago. So, if you have a blood test scheduled, avoid alcohol for at least 3 days prior to the test. Take a screenshot of this blood test preparation checklist. Fasting for 8 to 12 hours and water only for 4 to 6 hours. No alcohol for 72 hours before the test. Avoid intense exercise for 24 hours. No vitamins or supplements on the test day morning. Get 7 to 8 hours of sleep the night before. Don't smoke for 2 hours before the test. Inform your doctor about all medications. Avoid testing when you're sick and bring previous reports for comparison. Following this checklist can save you thousands of rupees of unnecessary tests and treatments and months of anxiety. So here's what I want you to remember. Your blood test is only as accurate as your preparation. The most expensive lab in the city cannot give you correct results if you didn't prepare properly. In India, where healthcare costs are rising and medical anxiety is high, getting accurate results the first time isn't just convenient, it's essential. If you feel that this video saved you from unnecessary tests or spending money, share it with someone who needs to hear this, especially someone who is wanting to get their annual health checkup done. And talking of blood test, did you know about these tests which are often missed in routine health checkups? See this video to understand more.